Hi, welcome to the MAP training on Medicaid Basics. The topic of this video is going to be the Medicaid Deductible. So there are a few different programs for people on Medicaid. We talked in another video about how there's 30 different Medicaid programs. And we only focus on the programs that serve older adults and persons with disabilities. So basically those programs that work with Medicare. And in the previous video, we talked about ED care and the Medicare Savings Program. So this video is going to be devoted to the Medicaid Deductible, also called the Medicaid Spend Down. So the dreaded Medicaid Deductible program, actually, even though it's a complicated and antiquated program, it does help some people. So, we're going to talk today about kind of the ins and outs of this program, but keep in mind that there is a population that is well served by this program. Now, sorry, having a hard time driving us today. So BEM 166 and 545 are the Visual Eligibility Manual sections that deal with the Medicaid Deductible. In order to get the Medicaid Deductible, a person must meet all the non-financial factors for Medicaid, and they must meet all the financial factors for Medicaid except income. In other words, they're going to have to meet the asset test for Medicaid, but they don't need to meet the income test. And really, what they're going to do is this program, can help people that have high medical expenses, but not enough income to meet those medical expenses. So there is no income threshold this program. Now, usually the Medicaid Deductible helps partially pay large medical costs such as hospitalization. Now, we're going to talk about this, and we're going to talk about how this is calculated. And one of the things that is used to determine the calculation of what somebody's deductible would be is the protected income level. The protected income limits have not changed since the inception of this program. So they really haven't changed in about 40 years. But even though the methodology is really outdated, it still does help some people reduce out-of-pocket medical expenses and help them qualify for the low-income subsidy. The Medicaid Deductible is an optional Medicaid category in Michigan. Some states don't even have this category. So even though as we kind of going to go through this, it's not, it's not the perfect program, it does provide quite a bit of good to some people. Now, let's figure out how to calculate the Medicaid Deductible. So, in a nutshell, how the deductible is calculated is it's the person's net countable income. And you're going to subtract the protected income level from that, and then subtract the total health insurance premium, and the difference is going to be the deductible. So this is a monthly deductible that somebody would need to meet in order to get Medicaid. So a person would meet their monthly deductible, and once their deductible is met, their Medicaid would be turned on. Now, so when a person is trying to meet their deductible, they would incur medical expenses equal to or greater than the deductible amount and submit proof of these costs to their DHHS worker. And then the great thing is that the bill doesn't need to be paid in order to count towards the deductible. A person just has to incur the expense. So this really does allow patients the flexibility to make payment arrangements with their providers if their providers would allow that. And this is a monthly deductible, so the process starts all over again the next month. So let's look to see how the deductible is figured out. And I'm going to go to the policy manual. Referenced on the other side, it's dhhs.michigan.gov/OLMWEB/DX/HTML. You can also get to it michigan.gov/DHHS policy manuals. So I'm going to go reference the tables, the RFP tables, in order to figure out the Medicaid deductible. I'm going to click here. And the first thing I need to know is I need to know what the shelter area is. So I'm going to click on RFP 200 for the shelter area. I'm going to scroll down, and I'm going to look for my county. Now, the way this works is this is just like page 2, it's just a continuation of page 1. So column 1 is going to be a continuation of column 1. So this is shelter area 6, and you can see that, you know, the AAA-1B, all of the AAA-1B counties are in shelter area 6. So that's what I needed to know is the shelter area. I'm going to go back to this reference table. And now the next thing I need to know is the protected income level. So it's RFP 240. So on this chart, it goes by group size. And generally, we're just dealing with a family of 1 or a family of 2 most of the time. And then here are the shelter areas. So if I'm working with somebody who's a single person, we're in shelter area 6. The protected income level is 408. Now, the rationale behind this is when these figures were adopted, the protected income level was sufficient to cover all of your rent, your utilities, your cost of living. So again, you know, these numbers haven't been updated in 40 years, and it's not. There's no mandate to do that. So we have a protected income level of 408. Now let's go back to the slide, and let's look at this example. So Joe Jones is single, and he's living in Oakland County. Sorry, there's a typo. So his gross Social Security amount is $950. He has a $250 pension. So his total income is $1,200. We're going to subtract that $20 disregard. In his case, he had a guardian, so subtract that guardianship expense. And so his net countable income is $1,120. We're going to subtract the protected income level of 408. And let's say he has Medicare insurance premium and a Part D plan and maybe a small supplement. And so, you know, subtract his health insurance premiums from that. And so in this example, we're left with a monthly deductible of $482. So Joe Jonas would have to meet a deductible each month of $482 in order to get Medicaid for the remainder of the month. So each calendar month is a separate deductible month. And eligibility exists if one of the following meets or exceeds the deductible. So really we're looking for medical bills or long-term care bills. And they can be old unpaid bills for medical expenses for which the client is still liable. So if, as long as it just has to be an active bill, meaning that the provider didn't write it off. So if they're still getting billed each month, now they can't double dip. They can't use a bill more than once. But if they've never used a bill to meet the deductible before, they can use old unpaid bills. And the great thing is if, let's say, if you have a large bill or a lot of bills, you can use the bills for up to 3 months retroactive coverage, and you can also use the bills for up to 6 future months. So let's say, we have, a deductible of $400. Well, and let's say he has a bill of $1,200. Well, they can use that either going backwards if needed or going forward. They just, the person would just have to say what they wanted. But, if they have a bill of $1,200, well, that goes into the $400 deductible 3 times, so they can get 3 months of coverage out of that one bill. Current bills for personal care services in the client's home can be used to meet the deductible in an adult foster care home or homes for the aged. Any bills for hospitalization, any bills for co-payments or deductibles, and bills for glasses, dental, and other uninsured costs. So there's a list of allowable expenses for meeting the deductible in BEM 545. A person does not have to pay the bill for it to be counted against the deductible. The expense only has to be incurred. And even if the expense was turned over to a collection agency, they can still use it to meet the deductible, just as long as the expense has not been written off. Now, old bills can only be used once to meet the deductible, even if the liability still exists, so there's no double dipping. And there's a deductible report that may be used to report medical expenses to the worker, and that's DHS Form 114A. But this deductible report is not required. It's just like this cover sheet that you can list, like, the expense and the amount, and it's there to make things nice and neat and pretty if that works for the beneficiary, but they don't have to use it. Simply, all they have to do is submit the expense. So here's an example for meeting the deductible. Joe Jones was hospitalized in January of 2016 and still owes the Medicare Part A deductible of $1,288, but it's been turned over to collection. His doctor has scheduled him for surgery in July. He has recently applied for Medicaid and was told his deductible is $540. He sends proof of his old hospital bill to his worker. The worker determined that Joe's old hospital bill is enough to meet the deductible for all of July and even August if he wants coverage that long, for example, therapy or follow-up visits. Or he may use the remaining $748 of the old bill for another future month. So you can see the $1,288 deductible minus the $1,288 Part A deductible minus the $540 Medicaid deductible is $748, and so he can use that $748 to get coverage for Medicaid for another month if he wants to. So here's another example. Lucy is admitted to the hospital for 3 days. Her bill was $10,000. She has other insurance, but it only pays 80%. her Medicaid deductible is $700 a month. So the whole bill was $10,000, but the insurance paid for $8,000. So that means that Lucy is responsible for $2,000. So Lucy is responsible for the first $700 of the hospital expense, because that's what her Medicaid deductible is, and Medicaid is authorized for the balance of $1,300, and for any other medical costs incurred for the remainder of the month. Lucy does not actually have to pay the expense for Medicaid to be activated. So that's a really good example of seeing how the Medicaid deductible works with insurance. So that concludes this section of the Medicaid training. If you have any questions, please contact your site coordinator or myself. And thank you so much.